Thank you both. It is 8:09 Thursday morning. That's when we talk to Dr. B, our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health, about senior health. Good morning, Dr. B. How are you?
Hey, Tommy. I'm doing good. How about you?
I'm trying to get over that 3-game losing streak, but I saw some progress last week, so I'm optimistic.
It was pretty tough.
It was
pretty rough. Hopefully better this week.
Matter of fact, we'll talk to Deuce McAllister about that next half hour. Seeing your primary care physician at least once a year is important, and in honor of National Primary Care Week, Dr. Brent Wallis from People's Health is going to explain how to make the most of your primary care visits. I guess the first question, Doctor, is what does a primary care physician do?
Sure. So a primary care physician, that's what I am. We actually practice general health care. So we do a lot of different things. We address a whole variety of problems and health concerns that a patient may have. But, primarily we focus in 3 different areas. The first is preventative care. So that's kind of evaluating your health risk and assessing, what's going on with you and doing screening exams. But then we also do acute care, and that would be treatment for common illnesses, things like sinus infections or the flu, maybe allergies, very common things that we see daily. And then the last is chronic care, and chronic care is the diagnosis and really management of chronic conditions, things like diabetes and high blood pressure that unfortunately so many people have.
I would imagine it's pretty important to establish a relationship with your primary care physician.
Yeah, definitely. As we get to know you, we can really individualize, what our plan is and what your healthcare needs are. And we can offer more personalized care, the better that we actually know you. So it's really important to kind of establish that relationship with your PCP and establish trust, so that we can, we're going to provide most of your health care. Like I said, things like checkups and screening, vaccines, even lab work. And when we can't provide all of those services that you need, we are also going to coordinate care with the other doctors or even send you to a specialist, maybe refer you for something that we can't directly treat or address.
All right, we're talking to Dr. Brent Wallis, Chief Medical Officer at People's Health. Dr. B, about Primary Care Week and seeing your primary care physician. When we come back, we'll talk about how often you should see him. Tommy Tucker, glad you're with us. Back in a flash, WWL. 8:15 now. We're talking to Dr. B, Dr. Brent Wallis from People's Health about senior health, and it is Primary Care Week, and we're talking about the establishing a relationship with your primary care physician and why it is so important to see him regularly and what do they do. And I guess now, Doc, we're talking about how often you should see your primary care physician.
Yeah, so really every adult, regardless of your age, should go to see their PCP at least once a year, and that's usually for a comprehensive wellness or an annual checkup and all of those preventative screenings that we were talking about. But keep in mind, your doctor may change the frequency of your visits. They may ask you to come back a little bit sooner, and that's usually based on something that they've seen during the exam, maybe some risk factors that you have or results of your screening test. And certainly if you've got a chronic illness like diabetes or hypertension, they're going to ask you to come back more frequently than annually.
If you're healthy, do you need to go see the doctor?
Yep, absolutely. And, it's just like with your car. You don't want to wait until it breaks down and then you take it in for service. You want to get regular checkups so that you can actually identify disease earlier. It's a really great time to talk with your doctor about what you can do to prevent future health problems. Like I mentioned, to get all of those screening exams that are so critical to find out what may be going on with you. And keep in mind that those chronic conditions can begin with sometimes, few or even no symptoms whatsoever. So that's why it's so important to get regularly screened.
Speaking of screenings, what should we get done each year?
Well, it's going to be personalized. I mean, your doctor will talk to you and decide kind of what things need to be done for you, what certain tests you need, vaccines, any screenings. But it is going to be based on your age, any sort of health risk that you have, and your actual medical history. We do a whole lot of things at these exams, but in particular, usually everyone gets screened for things like cholesterol, and that's to check for heart disease. For women, we actually recommend mammograms to check for breast cancer, osteoporosis screenings to check for bone density so that we can prevent fractures later in life. And then everyone needs a check for glaucoma to make sure that the pressure in your eyes is normal so you don't develop vision problems. And then very important is colon cancer screening. We recently lowered the age down to 45 to begin that screening, and that's to check for any sort of cancers in your GI tract. And then blood sugar screening is critical. We have a huge number of people with diabetes in Louisiana, so we want to identify that as early as possible so we can put a plan in place to hopefully prevent any complications, that you may have later in life.
What can we expect when we go to see our primary care physician? Because the whole idea is to get as much as you can out of the visit, right?
Yeah, absolutely. And, excuse me, you shouldn't be scared. A lot of people are scared going to the doctor. They don't like to come to the doctor. But you should be establishing a relationship with your primary care physician. It really should be based on trust. And so at that first visit, it's really to establish the relationship, to get a better understanding of what's going on with you. We're definitely going to ask a lot of questions about your medical history and what health needs you have. But we're also going to review a lot of medical records, any medications that you're taking, and really discuss your personal or your family medical history, because things do run in the family a lot, and so we want to know about that. And, so one thing I tell people all the time when I meet them for the first time is be honest. We've heard everything, so you can't shock us at all. And it's really important to be honest about what's going on with you. If you smoke and drink, let us know about it, because it's going to really allow us to kind of, organize and personalize the care that you need and make appropriate recommendations for those screening tests as well. And then, when you do a follow-up visit after you've established care, it may be a little bit shorter visit, but it's going to be focused on kind of how are you doing on your health care goals, where are you on your chronic conditions, and really how are you, how's your overall wellness.
You're not judging. You're not there to all you're trying to do is see if anybody's sick and treat it and heal them if they are, right?
Absolutely, absolutely. You can tell us just about everything. You can't surprise us.
The two people you do not want to lie to life in are your doctor and your lawyer. They do not like surprises because they're just trying to fix a problem. 8:20 more when we return. We'll talk about some of the things you should discuss with your primary care physician. Dr. Brent Wallis is our guest. Dr. B, Chief Medical Officer at People's Health. It's National Primary Care Week, and we're talking about visiting with a primary care physician. 8:21 traffic, WWL. 8:25 now. Tommy Tucker, WWL, Thursday morning, October 6th. Dr. Brent Wallis, Dr. B from People's Health, Chief Medical Officer, nice enough to give us half an hour of his time so we can talk about Primary Care Week and National Primary Care Week and how important it is to see your primary care physician. We've already established, unless there's a reason, maybe once a year, right, Doc, and get the screenings that you need?
Yeah, at least once a year, definitely.
And when you're there, what are some of the things you should discuss with that primary care physician?
Yeah, you can really talk to your PCP about any health concerns or really anything that maybe is out of the normal for you. So that could be something that's changed. You're not able to do something that you used to be able to. Maybe you're having trouble sleeping. In particular, if you're feeling a lot of stress or depression, that's definitely something that we can usually help with. And then, pain, probably one of the biggest reasons why people come to see the doctor is something's hurting. And so we can kind of tease out what's going on and is there a way to easily treat it and try to eliminate that pain. The other thing is if you're taking medications, definitely talk to us about any side effects that you're having. We can usually adjust medications that you're taking or the time that you're taking them and avoid or eliminate those side effects completely. So make sure you let us know about that. But in particular, you want to talk about your health goals. What is it that you're trying to do? Because everybody's a little different. Some people may want to run a marathon, And other people may just want to try to get across the room and make something in the kitchen for themselves. And so we can help you set those goals and make suggestions like changing your diet or your exercise routine that hopefully can improve your overall well-being.
And as we were talking about before, you do want to maximize your visit. You want to make the most of your time, get the most out of it with your primary care physician, right?
Yeah, definitely. I mean, it helps to be prepared when you go in to see your doctor. It's usually a little bit stressful for most people. You don't know what we're going to do to you and what test we're going to recommend. So, I mean, there are a couple of things you can do. Try to get there on time, and you should expect your doctor to be on time as well. But make sure you get to your appointment when you're supposed to, so that there's no delays or anything. A lot of practices allow you to check in online, and especially at your first visit, there's going to be a lot of paperwork. We really need to investigate, what's going on with you, what's happened in your past life and everything. So download that paperwork and try to fill it out in advance so that your appointment can begin right away. And then I cannot say this enough, if you are on medications, please bring those with you to your first visit. And if you use a pill box, bring the original bottles, because we want to look at those. We can usually determine a lot of your diagnoses and your chronic problems that you have based on those medications. It takes a lot of the guesswork out and everything. And then, when you're in there and you're talking with your PCP, be specific about why you're coming in, why you're there, so that the visit can be focused on what you need to accomplish during that visit. And don't feel bad at all about bringing a list of questions. I have a lot of patients that will come with a rather long list, and while we can't always address every single question at that visit, it helps to write them down so you can have a really good conversation with your doctor about what's going on with yourself.
Everybody's got phones. I guess you could take a picture of each of the prescription labels if you need to, right? If you can't write it down, bring it.
Yeah, absolutely. That's a great idea, and that actually helps, too. If you lose any of the medications or, if you have to be out of town, you've got them with you all the time.
And if somebody sees a specialist and they have a medication that is added, I guess they should tell the specialist what they're taking, but should they then also check back with their primary care physician to tell them that, hey, I'm on this as well, so they can check to see if there's any conflict?
Yeah, always. So we can look for interactions between the medicines, and hopefully we referred you to that specialist, but if we didn't, let us know you went, so we can get all the notes from that doctor as well and find out what their plan is for you and kind of coordinate that care.
The idea is to get better. Thank you, Dr. B. I appreciate your time.
Thanks, Tommy. Have a great weekend.
You too, and let's hope they beat the Seahawks. If you want to find out more about People's Health, you can go to peopleshealth.com. You can visit the People's Health Medicare Center at 3017 Vets in Metairie next to Party City. Appointments are recommended, but walk-ins are welcome. You can call 1-800-978-9765. And, of course, you can follow People's Health on Facebook, Twitter, and Instagram. 8:30 when we come back, we'll talk to the one and only Deuce McAllister about the Saints right now. It's time for WWL First News. For that, we go to Ian Ozan.